If one of your patients or clients has sciatica, which region is the most likely region to have the worst possible adhesion so you can get the quickest, most permanent pain relief? 80% of nerve entrapments occur proximal to where the symptoms are presenting, 20% occur distal to where their symptoms are presenting. This is an addendum to the 5-day free Find, Feel, and Fix the Worst Spot for Chronic Sciatica Challenge. People have been asking us on Instagram or YouTube, how do we take this further? So I just wanted to share some of where you can find the worst possible locations. So typically, if somebody is having glute symptoms here primarily, this is where you think the sciatica is coming from. Typically going to look to the low back and the glute area. And this is the spot that we show you how to check during the 5-day challenge. If somebody's having posterior thigh symptoms, you're typically going to check low back, but especially the glute, and maybe a little bit of the proximal posterior thigh. If someone's having posterior knee symptoms, you're going to check the glute and the posterior thigh. And the calf, you're going to be checking the posterior thigh and posterior knee, and so on. If they're having foot medial plantar nerve symptoms, lateral plantar nerve symptoms, you're probably going to check in the calf and then in the medial ankle as well. This is a helpful distinction because it can be overwhelming to check a million different body parts when you're just learning how to feel. So if you know where to focus your attention and time, if you know that this is going to be the most probable spot to find a nerve entrapment, then you just spend a lot of time in this surface area instead of diminishing your attention on the low back here, the posterior thigh, and the calf. It's too much. So I used to ask my mentors, where's the most likely spot that I could find entrapment? And they never liked that question, but it allows us to focus and to bring our attention to one specific spot. Try this distinction. Make sure you're paying attention to where the symptoms are and check just proximal to that first and see if you can find a spot on the nerve that's not moving and stuck. If you find it, great, treat it. And if you didn't find it, then you'll know that you need to go probably a little bit more proximal to find the area where it's stuck. Enjoy this distinction. If you try it, let me know how it goes in the comments. I'm always curious to see how you're doing with these protocols and this technique. If you'd like to see more about how we fix chronic pain at Barefoot Rehab in New Jersey and with Adhesion Release Methods across the world, hit the like, hit the subscribe, and stay tuned for more videos that we will be releasing each week.